to a cooperation project within its South-South cooperation program in the health sector to help the government of Mozambique to set up an antiretroviral pharmaceutical factory in Maputo, Mozambique. Why is that? Well, the word Brazil has been popping up today several times because Brazil is really expanding, has a history, has a track record of innovative pharmaceutical manufacturing in Brazil, in middle income country, and a track record of successful AIDS fight in Brazil, and it's getting into this new model of cooperation, which is called South-South, cooperation between countries belonging to the south of the planet. We believe that this particular experience provides an insight into local production of pharmaceuticals in low and middle income countries. Just to give you an idea, framing the issue of what's going on, this graph from UNCTAD, represents the net trade flow of pharmaceuticals across the world, and you can see that the gap between rich countries producing pharmaceuticals and exporting pharmaceuticals and poorer countries buying pharmaceuticals is growing wider and wider. So the question is why, if those countries, the poorer countries, have a larger burden of disease, are not producing their own pharmaceuticals for their own need? Well, until very recently there was a consensus that production of pharmaceuticals, a very complex product in a low-income country, was not feasible, because there was a lack of capacities, there was a lack of a critical mass in the industry to provide, human resources, to provide technologies, to provide all the services around. And this consensus was quite clear. There are two key references on this consensus by the WHO and by the World Bank, claiming that local production of pharmaceuticals was not the way to go. But then that was the theory, but the reality is something different. We are seeing that more and more African countries are acquiring their own pharmaceutical companies, their own pharmaceutical industry. 38 out of 55 in the last count. And there are countries like South Africa, or the North African countries, they are becoming, powerhouses. In South Africa, Aspen will start production of APIs this year, for example. So the reality in the field is changing. It's telling a different story from what the theory and the consensus has been so far. Recent research has also shown that the price of pharmaceutical produced in low and middle income countries can be competitive. So there may not be a cost and price issue there. So the UN is slightly changing its attitude, and it's also helping out. UNIDO and especially the EU are helping out the African Union to put together a business plan for the pharmaceutical industry in Africa. Some authors, and this is a paper from the Lancet, also claim that the situation has changed because the funding environment is changing. There is so much more AIDS money around, and this is really changing a shift in people's positions. Brazil, beautiful country. Brazil has a history of developing its own domestic industry. State-owned pharmaceutical industry in Brazil has played a very important role in the AIDS fight. It was thanks to this industry, to this state-owned industry, that it was possible to roll out the scheme of free access to ARVs, to everybody, universal free access of pharmaceuticals. And it was thanks to having their own pharmaceutical industry that it was possible to threaten, to make realistic the threat of compulsory licensing for ARVs protected by patents and the law, and so negotiate down the price of those ARVs. So state-owned pharmaceutical industry in Brazil has played a very important role in the AIDS fight, and this is recognized, widely recognized in the literature. Although, mind you, the only 5% in volumes of the drugs circulating in Brazil these days are produced by the state pharmaceutical industry, only 5%, but it's still playing a very important role in the wider scheme of the market, of the pharmaceutical market in Brazil. Brazil is getting into this modality of South-South cooperation, focusing on Portuguese-speaking African countries. Of course, the language is an advantage. On Latin American countries, why are they doing it? We did some study, we did some work on that, and we arrived at the conclusion that they're doing it mostly because they want to strengthen its international standing, and they want to open access to different markets. They openly say that cooperation is a tool, is a foreign policy and commercial tool for Brazil. Brazil cooperation is aimed at reproducing the domestic success stories. The AIDS fight in Brazil was very successful. The Sistema Único de Saúde, the unified healthcare system, the malaria and dengue fight, human milk banks. So they're basically what the Brazilians are doing is that they are taking those experiences that were successful back home and trying to export those experiences in Portuguese-speaking African countries or Latin America. The principles of this new form of cooperation are based on state-owned capitalism, very typical of BRICS, health diplomacy, and this concept of industrial health complex says that in order to develop your own the national healthcare system, you need to really invest on your own pharmaceutical production capacity, in your pharmaceutical industry, in your biotechnological industry, because that would create the critical mass and would to really invest and develop the healthcare system. Quite an interesting way of thinking, I have to say. So what they are doing in Maputo, in Mozambique, this idea of building up an antiretrovirals factory was born out of an informal conversation between former presidents Inácio Lula da Silva and Joaquim Chissano, two very influential people. They agreed on this project that was back in 2002, I believe, and then it has taken 10 years to really implement the project. The factory called Sociedade Moçambicana de Medicamentos, Mozambican Pharmaceuticals Limited, will be owned 100% by the Mozambican government, so it's going to be an entirely public factory, and it will be managed by the State Shareholding Management Institute, not the Ministry of Health. That's a very important difference from what we see in Brazil. The investment, we are approaching 35 million USD. The best part of it has been already spent, and it was funded by three main tiers: the government of Brazil, the government of Mozambique, but also Vale, which is the world's second largest mining company. It has a very important operations in Mozambique, in central Mozambique, and it happens to be Brazilian, by the way. The factory will produce 21 generic drugs, among which there are six antiretrovirals. And they were planning to construct these, to build up this medicine quality control laboratory, which is going to be the first of such labs in Mozambique. Mozambique has no capacity to control, to check the quality of the drugs entering the country. That's very important to understand that. What has been achieved so far? The factory has been completed, has been inaugurated several times, to be fair, and it's a bit of a stunt event. The lab has been inaugurated, and it's working. It's already supporting the Ministry of Health to check the quality of the drugs circulating in the countries. Staff have been trained in Brazil and on the job in Mozambique, in pharmaceutical production, but also in pharmaceutical management. And they are applying for the WHO quality certification for the drugs, which is expected to be obtained in 2014, late 2014. The files for 8 medicines have been already transferred. This is clear technological transfer from Brazil to Mozambique for free. And secondary and tertiary production was started this year for one drug, nevirapine only, and drugs have been donated to the Ministry of Health. Yeah, just to conclude, this is the prices that the Sociedade Moçambicana de Medicamento is going to sell, the unit price that they're going to sell, retail price that they're going to sell for specific antiretrovirals. You will see that they are no higher than the prices of the drugs circulating, imported by WHO and PEPFAR in the country. This is a medicines MSH reference price. Rather the opposite, PEPFAR drugs tend to be much more expensive. There are still some outstanding issues, for example, sustainability. At the moment, Mozambique is receiving free of charge all his antiretrovirals. So what's the point of having to pay for its own drugs if it is receiving all the drugs for free at the moment? The ownership of the factory is not very clear. The government has been slow to jump on board on that, because it's clearly seen that it will have to find 50 million USD per year to buy its own drugs, while at the moment it's really giving it for free. Access to market is a problem, because the factory is planning to sell to the local market, but the local market is stifled by free antiretrovirals. There is no such a thing as a local private market for antiretrovirals, because drugs are circulating for free in Mozambique, and the competition in other southern African countries is rife. So, take away lessons, insights from this experience. Production costs for antiretrovirals produced in Africa may not be the problem. It may be possible to achieve competitive prices, especially if you are saving on the initial investment and you're not making a huge profit to recoup these investments. But rather, the lack of flexibility of the fundings available, it may be the problem. The Americans, they at the moment are procuring antiretrovirals and giving it for free to Mozambique, are not willing to give those monies to the government of Mozambique to buy from other sources. So where is the money going to come from? Third point, the ARV market is too narrow a niche for local factories to concentrate, because the market is marred by decreasing margins and it's distorted by external funds. And finally, the information benefits stemming from having a local, publicly owned factory in Africa are huge, because the government can learn about the surveillance, what is working, what is not, whether the drugs are developing resistance, but also the insight on the costs will help the governments to negotiate prices for other drugs, the way it happened in Brazil. And these are my references. Thank you very much.